Greetings, everybody. I'm Professor Lorraine Sher, and I'm based at University College London. And I'm going to talk to you today about a paper that a large team have put together and published in the Lancet just in the last few weeks. And our paper is called Under the Radar, the Global Minimum Estimates for Pandemic, and that's the COVID pandemic, associated orphanhood and death of caregivers. The team was led by Dr. Susan Hillis at the Center for Disease Control in the USA, and a large team who I will mention because this stuff is too important and required huge groupings. Dr. Etty Unwin, Yu Chen, Professor Lucy Kluwer from Oxford, Philip Goldman, Seth Flaxman from Imperial, Oliver Rettman, Crystal Donnelly, Samir Bhatt, Gretchen Bachman from USAID, Laura Rawlings from the World Bank, Phil Green, and Charles Nelson. So you will see that this is quite a concerted and huge effort, where what we were trying to do was to understand the global impact of COVID-19 associated deaths. There's been some press attention lately, and we have seen focuses on what is happening, but very little government or high policy action. So what's the background? There is early evidence of challenges with parental or caregiver losses. This we know. At the beginning of COVID, for example, adoption and foster care services became quite strained. Also, the role of grandparents. We know that grandparents play a key role in taking care of children. For example, in Brazil, 70% of children receive some support from grandparents. In the USA, 40% of grandparents living with children serve as the primary caregiver. In my country, the UK, 40% of grandparents provide regular care for children. And globally, we know that 20% of the population, often in multi-generation households. And what has COVID done with all of this? So we estimated orphanhood and caregiver loss, the two big things in a child's life, by using excess mortality, COVID-19 mortality, and calculating male and female fertility rates. So this is a model, and it's trying to give us some ideas of the silent pandemic under the radar, where we're so focused on the biomedical, on the virus, on the treatment, on the hospitalization, on the oxygen, on the surges, but what about the children? We defined a child as under 18, and we used the UNICEF definition as the loss of one or both parents for orphanhood and a loss of a caregiver. And a co-resident grandparent caregiver, we looked at sort of skip generation and households, and caregivers under 60 who live in a household and they have a child living in the household and obviously provide quite a lot of the day-to-day care of the child. And then we extrapolated using several models to a variety of countries across the world. We tried to look at minimum estimates for children using 21 countries that account for about 77% of the global COVID burden. And we come up with some really interesting findings. So, for example, the countries that are in the top cluster are countries like the USA, Mexico, Colombia, Peru, Brazil, Argentina, India, you all know about the surge in India, Russia, South Africa, Zambia, Nigeria, and Kenya in Africa. And we've also looked at countries across Europe, the UK, France, Italy, Spain, Germany, etc. If you take India as an example, we know that the total number of children orphaned or losing caregivers as of February, March, and April 21 has started to surge. By April, our estimates suggested an 8.5-fold increase in the number of children newly orphaned, greater than 45,000 children from March to April, compared to the increase in children newly orphaned observed in March. So what we're actually seeing under the surge conditions, this moves very rapidly. So there's very little time to prepare. And over the short period of time, when there is high burden of adult deaths, children are dramatically and very rapidly affected. We've looked at countries across the 21 that I've mentioned, and there are some that are really showing quite high rates per 1,000 children. Countries like Peru, South Africa, Mexico, Brazil, Colombia, Argentina, Eastern Mediterranean, countries like Iran. So I think we need to try and focus on this. We then did some calculations over time and were very struck by the time periods of how quickly this gathered momentum. And we see what we call high burden countries, the ones I've just mentioned, and also surge countries. In a way, what happens to a country when it moves from a high burden to a surge is the numbers go up, and they go up rapidly. What we actually looked at in the paper when we did our calculations, we found that during April 2021, which is really this year, due to COVID-19, every 12 seconds, one child was orphaned or faced death of a grandparent or a caregiver. I think these numbers are startling, and they will increase. The group have created a calculator, so if anyone is interested in looking at their country and a real live current present time rate and rates plotted over several months, we've created a widget which Imperial College has on their website, and anyone can go to it. We'll try and ask the organizers to put the website online so people can actually look country by country and try and get some understanding. And behind that is the need for us to very quickly get everybody organized to try and put children at the center of policy for provision, because we are generally unprepared. The paper had received enormous attention, but we want attention to be followed dramatically by action. We've presented in many countries and in many languages, and the team came up with a call to action for children facing COVID-19 orphanhood, and we've called it Prevent, Prepare, and Protect. So preventing death, we want to support vaccine equity and public health prevention, all the measures that many of us know. Prepare, well, we want to prepare families. We want to support kinship, fostering or adoption for children in need of alternative care. And we do know that orphanages bring with them, for the most part, some considerable problems for children. And we want to avoid orphanages. We want to avoid the mushrooming of orphanages. And we want to avoid the negative elements of orphanages. We also want to allow for subsidies and support of the families who take on the children, so that the financial burden doesn't detrimentally affect either the receiving family or the child. And then to protect children, we want to use evidence-based strategies that address increased risks of violence and vulnerability and strengthen recovery and the resilience that many, many children do show. So we all know that preventing and getting the vaccines out is important. I mean, we need to protect our grandmothers if we don't want them to be lost as caregivers. And we know about COVAX, the system that will deliver vaccines. And our team was saying, what about CareVax? We need to give vaccines, but also we need to impress on everybody the need for good quality care, funded and resourced. For Prepare, we need safe and loving family-based care support service. We could model these on HIV programs, so we've got a lot of experience. We want to avoid orphanages and institutions. And we do know that a lot of literature that is disturbing about these, and we don't want children's growth or attachment or structural neglect or abuse to be enhanced, a burden that they don't need to face. To protect children, what are the evidence-based strategies? Well, we do know some work done together with Lucy Kluver and a huge Adolescent Accelerate team, that if you put good interventions together, you get an accelerated impact. Things like positive parenting, economic support, educational growth. We know that the World Bank is fostering cash transfers. Well, these should be streamlined to these families very quickly to alleviate very dramatically and very rapidly any financial burden. but support them with safe environments, good schooling, and those are the things that may be disrupted for children as they sit alone and are cared for in haphazard ways. So finally, our conclusions are everyone thinks COVID is a disease in which older persons are more likely to die and doesn't impact children. But well, our data shows actually this is not the case. We need a full and up-to-date understanding of the number of children who have been left behind from the 4 million pandemic dead. And we need to put orphaning and caregiving in focus for data collection. We need to, whenever somebody dies, we actually need to have a list of who are the children, just how many, what are their ages, so we can start to gather insight. Children should be central to the focus. They shouldn't be the afterthought or under the radar, or suddenly we wake up and see, oh my gosh, what have we neglected? We need to provide services. We need to remove the invisibility cloak, as Harry Potter would say, count the children, get the kaleidoscope and look at the children, and then you will see that they are there and the problem is upon us. Thank you very much. And I do hope you will follow the paper in the Lancet. You can go to the CDC website for our full report and make a fuss in your own country to see how children are being affected by the pandemic and what the responses are. Thank you very much.